Hello everyone, this is Dan with Your Average Med Students, and in today's video, I'd like to spend a little bit of time to offer some high-yield tips and tricks in getting through both UWorld as well as Amboss question banks. For reference, both Ryan and I, we both received a 260 plus on Step 2 CK, which we have also made a video previously on some more general advice, which can be found in our channel. So a little bit to preface the video with, UWorld and Amboss are both question banks, as you know. If you're watching this, you probably know what UWorld and Amboss are. There are about 3,000 or so questions. UWorld actually has 4,000, whereas Amboss has 3,000. But they're more or less pretty similar. If not harder than the USMLE Step 1, 2, and 3 exam questions. So these questions are often accompanied by answer rationales that are really rich in high-yield, useful information that will help students better understand the concepts that are commonly tested in both Step 1, 2, and Step 3 exams. And the best piece of advice among probably many test takers is that the completion of at least one of these Q banks is very high yield in achieving a really high score on these standardized examinations. However, these question banks, I will admit, are very beefy, and completing it for the average student can take often 2 to 3 months of time, which when you're dedicated and you're in the middle of medical school, this is a lot to sort of ask for. So in our community, Ryan and I, we both really emphasize the strategy of completing as many questions as possible in these question banks to succeed in both Step 1 and Step 2. So over the course of our own Step 2 dedicated, we both completed nearly 20,000 questions from a mixture of these Q banks, so UWorld, Amboss, and MBMEs. And this took us roughly about 2 months at a time. In other words, we basically went through multiple passes of these question banks to maximize our chances of success. And again, we sort of posted a video about this, and I do think it's well worth the watch if you have the time to look at it. A lot of our viewers from our previous sort of videos have also been asking, guys, how do you even complete these Q banks so quickly? I spend maybe 1 to 2 hours just to complete 40 or so questions. How are you able to complete 90 questions in 90 minutes? And in this video, I'm hoping to sort of elaborate on how we're able to get something like that. So the very first thing that I want to talk about is something called the Pomodoro Timer. Now, this is going to be really quick because if you're a medical student or you're someone working in healthcare, and chances are you're really good at studying, you probably already know what the Pomodoro Timer really is. But I just want to offer my own version of the Pomodoro Timer just so it can help any students that might want to utilize what I'm doing when it comes to preparing for Step 1 and Step 2. So for me, I like to do roughly 90 minutes of intense focus, and intense focus in this case is obviously completing the Q bank. 90 minutes of getting through the Q bank, and then followed by a 10-minute break. And I would repeat this probably about I'd say 4 to 5 times per day to get through the 280 to 300 questions that both Ryan and I really emphasize in preparing for these examinations. Within these 90 minutes, while I'm doing the Q bank, of note, because a lot of people have been asking, these Q banks, I'm doing them both in untimed and tutored mode. Now, obviously, It's untimed just because I want, sort of I don't want to feel pressured when I'm sort of going through the Q bank, but I'm still under the time constraints of 90 minutes. And then tutored mode for reasons that will make sense in just a little bit. Okay, so next piece of advice I'd have for number 2 is sort of when you get questions correct, you just really want to skip rationale. This goes against a lot of what people might say. And let me just spend a little bit of time talking about my philosophy for this. If you are going through question banks like UWorld and Amboss at a speed where you can complete them 2 to 3 times before your actual test day, chances are you're going to come across questions that you've already seen again. And if you're resetting the question bank, you're going to see the same question you originally got correct once again. So on your first pass, when you're going through the first question, or when you're going through any question, and any question you get correct, I want you to skip the rationale. Okay, I don't want you to read about it, because chances are if you didn't guess on the question, you probably understood the logic well enough to get the question correct. Again, remember, step 1, step 2, step 3 isn't testing concept, it's testing whether or not you can get the question correct. It's all about getting the question correct. At the end of the day, at least in this community, all we care about is the 3-digit score that step 2 CK outputs. So in your first pass, you're going to skip the rationale for questions you get correct. And then in the second pass, chances are you're going to see that question again. Now, if you get the question correct, nothing to worry about, right? You just move on with your life. But if you get the question wrong, nothing. If you get it correct, if you get the question wrong, you're going to go through what I'm going to talk about in the next step, which is the whole logic I have for evaluating incorrects. I'm going to do the incorrect method, which I'm going to explain in step 3. All right, so let's jump into step 3 of sort of what we need to speedrun UWorld and Amboss. And this is probably what everybody wants to know. The best way to really talk about step number 3 or philosophy number 3 is with an example. So I'm going to pull up an example question from Kaplan over here, and then we'll start off by reading it. So we have a 65-year-old man. He has CKD, PVD. He's been hospitalized for a thromboembolic disease in his left leg, which is now accompanied by dry gangrene. On day 3 of hospitalization, basically has muscle weakness. We have an elevated lactic acid, RTO page is 7.27, creatine 3.8. And the question is basically asking, what will the EKG show? So the philosophy for step 3 is basically when you're going through questions, you always want to be thinking about, at least when you're reviewing question, you want to be thinking about what is the one piece of knowledge, of information that you need to know to answer the question correctly. And for me and for Ryan, we always remind ourselves of this philosophy whenever we are reviewing questions, because step 2 CK questions in general require a lot of pieces of information that come together. Remember, it is an exam that tests your ability to draw multiple pieces of knowledge, of concepts to result in an answer. So, for example, we have to know a little bit about CKD. We have to know a little bit about lactic acidosis. Muscle weakness can be associated with changes in potassium, thromboembolic disease. We have a lot of these little pieces of information that we really need to understand to get this question correct. But in my case, when I first answered this question, I chose UWaves because I thought it was hypokalemia. So if I chose UWaves, obviously that is going to be incorrect. And in UWorld and Amboss, it's going to pull up with a long, beefy rationale. Obviously, I cannot pull up Amboss and UWorld rationales because that would be copyright material. But basically, this is what it would show. And I apologize in this picture, it should actually be that I selected U waves and not T waves. But anyways, in this example, I chose U wave because I knew that there was a problem with the potassium. I just didn't understand which way it went. Was it hyperkalemia or hypokalemia, right? Now, you have to stop and think, what is the missing piece of information I needed to know to get this question correct? Up to this point, I already, made the mental hurdle of figuring out that there is a problem with potassium somehow, right? I understood that, okay, there's probably gangrene here, tissue's dying, there's potassium. I just didn't know if it would be low or if it would be high. Maybe that's, maybe you already knew the answer, but for some people, maybe they don't know the answer to the changes in potassium in this case, right? So I knew there was a problem with K+. And I already knew that, an elevation in K+ would often lead to peak T waves. And a decrease in K+ would often present with U waves, right? That's from the sketchy video that we're all very familiar with. Now, I just didn't know what the changes was, if it was going high or if it was going low. So you can see that the one piece of information that I needed to know to get this question correct was just knowing that in this vignette, you actually are going to have an elevation in potassium. Obviously, for the rationale over and over here, it's because when you have metabolic acidosis, secondary to chronic renal insufficiency, the lower pH can lead to an increase in protons, and that's going to drive the HK antiports on the cell surface, creating for hyperkalemia, which can obviously, as I would have already known by now, can affect the heart, causing some sort of arrhythmia that might appear on the EKG. But the key point that I need to know to get this question correct, to get my score from a 239 to maybe a 240, is that in situations where you have metabolic acidosis, you might get an elevation in potassium. And if I knew that piece of information, I can make the mental hurdle to know that the answer should have been peak T waves to make my score go from a 239 to 240. Okay, so let's go through another example where we can apply this. What information do I need to know to get correct philosophy? And we're going to be using an osmosis question here, which is also publicly available online, so I don't get sued. So we have a 38-year-old man who's being evaluated for anxiety with 2 episodes of LOC over the past 24 hours. Patient partner found them last night in the lawn with urinary incontinence, and again this morning in the kitchen. Patient's basically been feeling down, drinking more alcohol than usual since losing his job 4 months ago. He's been drinking up to 5 beers a night. No significant PMH. Temperature stable. Blood pressure is elevated. Pulse is 110. Respiratory rate 16. O2 status 99. He's diaphoretic and anxious. Evidence of tremor in his hand when the arm is outstretched and the fingers are spread. The underside of his tongue has a superficial laceration. An abdominal examination is unremarkable. They gave him normal saline. And the question finished off by asking, what historical element is most likely to be present given these answer choices? All right, so spend some time thinking about it. Think about what type of question this is asking, what answer it's looking for. And then once you got that, I'm going to start adding the image for the rationale. So here's the rationale for the question. Sorry, it's a little bit overlaid on the question over here, but I just want to bring up a couple of points with this question because I think it's a really great example for sort of the philosophy that Ryan and I want to drive home. So again, let's say you answer this question and then you chose let's say you're going through it, okay, and you chose the answer, D, cessation of chronic opioids, right? And you finish the question and you're asking yourself, okay, I got the question wrong. What piece of information do I need to know to get the question correct? So up to this point, when you've read the question, let's say you definitely know that you're in between alcohol withdrawal and opioid withdrawal, right? You're in between one of those two. but you just don't know which one it is. You can't remember which one presents like the vignette, right? So if you read the rationale here, you can see that it says over here, patients with basically opioid withdrawal symptoms typically do not have seizures, and they usually have gastrointestinal symptoms. If you can't read that, I'll make it a little bit bigger point here. They have GI symptoms, but they do not have seizures. And remember, in our vignette, our patient had tongue biting, which we may or may not have already known is related to seizures. And patient did not have any GI symptoms like diarrhea, for instance, right? So in this specific case for me, what I had needed to know to get the question correct was that I needed to know that chronic opioid withdrawal presents with GI symptoms. If I had known that, I would have chosen the correct answer, which is cessation of alcohol use or alcohol withdrawal symptoms, right? So as you can sort of see, between the first example we talked about previously and this example, the whole philosophy is dependent on your knowledge base. And this is why going through UWorld, Amboss and UWorld multiple times helps you build this knowledge, especially when you're just collecting single pieces of information at a time. So always remember to try and pick, or always try to remember to sort of understand what is the single piece of information that you need to know to get the question correct. If you can remember that, I promise you, speedrunning through UWorld will be super simple and super easy. You'll get through UWorld and Amboss quickly 3 to 4 times and have great success, right? And this entire process of going through the rationale and understanding what you need to know to get a question correct should only take roughly 30 to 45 seconds. You're just scanning this and saying, okay, I was in between alcohol use and chronic opioid withdrawal symptoms for both. I see chronic opioid has GI symptoms. This patient did not have GI symptoms. Okay, so I just need to know that chronic opioid withdrawal presents with GI symptoms. That's it. Very simple, right? You can skip main explanation. You can skip major takeaway. And this will only take 45 seconds. And that is precisely how we're able to get through questions at a relatively quick manner. Okay, the final point I want to talk about, and this builds on the previous point, is talking a little bit about Anki. And I'm going to make a video that's more in depth about how to use Anki in the future. But for the purpose of this video, we're just going to talk about how to use Anki in the context of your incorrects. So the best way to show this, of course, is with examples. So let's pull up the this image over here. If you remember the previous question, the first question about hyper versus hypokalemia. So again, if I had chosen the answer choice U waves, I want to create an Anki card that assesses the one piece of information that I need to know to have gotten this question correct. Again, so when you're going through your UWorld and Amboss questions, always paste the question in to your extra. And this is so important because when you're doing these cards, which you should be doing every single day, you're going to look at this card, you're going to recall it, and then you have to read the extra. You have to read the extra. And the reason why is because medicine and Step 2CK in particular is all about pattern recognition and repetition. And the more you see this question and go through the logic, the mind hurdle, the whole hoop hurdle you have to go through to get to this answer choice of peak T waves, the more accustomed you're going to be to these types of questions, and the more you're going to be able to better understand this question and apply that concept to the real deal, right? So in this case, again, paste the question into the extra with the rationale, but then in the text, try to keep the card as simple as possible. In this case, remember the only piece of information I needed to know was whether or not this was hyper or hypokalemia. I don't care about the HK antiports. That's important, but it's not important in the context of giving me a 239 to 240, right? So The card reads, patient with CKD and PVD plus thromboembolic disease with gangrene now has muscle weakness. Is this hyper or hypokalemia? Right? That's all I need to know. And the answer obviously is hyperkalemia. Now, think about it. When I see this card, I'm doing it, maybe 30 to 40 times in the length of my dedicated, and I come across this exact question again in UWorld, in Amboss, and I remember this single piece of information, right? I'm going to get this question correct. And this is what's going to get you from a 239 to a 40, or even a 249 to a 250, right? It's all about the one piece of information you need to know to get a question correct. And then once again, we can go through another example over here with the second question, right? With the alcohol withdrawal versus the opioid withdrawal. In this case, I just need to know that opioid withdrawal is differentiated from alcohol withdrawal by having GI symptoms. That was the important piece of information I myself needed to know to get the question correct. If I had known this, I would be able to answer the step 2 question. I would have understood that in this question, it was asking between opioid withdrawal or alcohol withdrawal. And if I have this card registered into my memory, I would know that it can't be opioid withdrawal because there's no GI symptoms, thus making me choose alcohol withdrawal symptom and bumping my score from a 239 to 240 or a 249 to 250, right? It's all about the one piece of information. Okay, so we made it through the end of the video. I'm just going to rehash a couple of final reminders for the video of sort of the points we've talked about. Remember, there's about 1, 2, 3, 4 points I want you to take home, okay? Pomodoro Timer, 90 minutes, 10 minutes. During this 90 minutes, I want you to do UWorld or Amboss on tutor mode, right? Tutor mode and untime. But, and that's point 2, remember to keep it at 1 minute and 30 seconds per question. If you're spending a lot of time on it, I want you to just pick an answer and move on. Obviously read the rationale and what we'll discuss in point 3. If you get the question correct, I want you to just skip it, because chances are you're going to come back to it again when you reset UWorld or Amboss. And point 3, that's just our philosophy, the one piece of information. When you're reading through rationales on questions you get wrong, do not spend more than 30 to 1 minute and just extract the one piece of information that you need to get the question correct. And lastly, in point 4, in Anki, transfer those one piece of information into Anki and always keep up with it. And I promise you, if you just follow these strategies in UWorld, in Amboss, and go through these questions over and over again, hitting 10,000 questions to 20,000 questions, you're going to get a really, really good score. So that's all I have for today. Thanks a lot, everyone, for watching. Hopefully this new format is better in terms of video output. Stay tuned for more content in the future. Thanks.